My name is Dr. Daniel Mac-etteli. I'm the MD of the Mac-etteli Clinic here in Yenagoa, Bayelsa State. I'm a graduate of the Niger Delta University, Wilberforce Island, Bayelsa State. I have a master's degree in public health. I'm the MD here, and I also work with the World Health Organization, Bayelsa State. The movie Ogbanje is a very laudable project. I think that it's very important that people get to know the difference between spirituality and medical problems in our society.
Tammy, please. Tammy, please stay with me. Oh, Auntie Mama, Tammy.
Medical problems most times are misappropriated for spiritual things, and so we think that people should know that when children die in childhood, one of the common causes is sickle cell anemia, and that's what this movie is really about.
Yet another wife that will have children, that will live. Please, I don't want you to marry that witch of a woman who keeps giving birth to Ogbanje's children.
And I have said no to that, Mama. I love my wife.
Now, sickle cell anemia is an inherited disorder that comes from both parents, who are carriers of the sickle cell disease, ASAS, getting married. When they get married, they have 25% chance of having a sickler child. That means that 1 in 4 of their children will likely have the sickle cell disease, or all 4 children may have the sickle cell disease, or none out of the 4 children, because we have seen some cases. So, but it's very important that couples before marriage know about if they know their genotype statuses, and they know about the sickle cell disease, because it's usually a lot of financial, emotional burden to the parents when they have such children.
Do something, Baba.
Your son is an Ogbanje.
Hey!
Yes!
Ogbanje.
Your son is an Ogbanje. But don't worry, everything will be fine.
Now, there are several things that can be done to prevent. First and foremost, you must know that sickle cell disease is not curable, but it is treatable. So there are several things that we do, even from birth, before birth, things like karyotyping. When the amniotic fluid in the mother's womb could be taken and tested, then you know if the child is going to be a sickler. And as soon as the sickler child is born, the child needs regular follow-up. Needs to be coming to the hospital, especially in the very young ages. If not, those children die. Have the highest probability to die at those ages, and that's what maybe our parents and forefathers will call the Ogbanje syndrome.
This boy is an Ogbanje. But don't worry, there is a solution. Hey, Eli, you are going to buy 10 packets of white candle.
Okay, and so those are the kind of things that we have seen them with clinical care and good medical support. Many of them live long, happy lives, even up to 30 or some 35, 40. And they are very skilled people, and they live their lives well, but they have several problems. One of the commonest things that you will see as symptoms are bone crisis, because of the sickling of the cells. The blood, oxygenated blood, is not able to get to the organs, so they have organ dysfunction. Then you see their hands, especially for the children, you see the hands and feet are swollen, and yellowish discoloration of different parts of the body. So I think that with this simple enlightenment that the Ogbanje movie provides, a lot of our parents, especially mothers, will know about sickle cell anemia, and for those who are not married yet, they know how to prevent having sickle cell anemia, children with sickle cell anemia, which just has to do with making sure you do your genotype, know your genotype before you get married. Yeah, this is test.
Yes, sir.
All right, thank you very much. These results show that both of you have the genotype AS, and it means that you are not compatible for marriage.
What does that mean, doctor?
That means that you are going to have children that have the sickle cell disease. You have 25% chance of having children with sickle cell disease.
So, does that mean my son is not an Ogbanje?
I don't know about the Ogbanje thing, but for sicklers, most of them die in childhood, and even when they live longer than childhood, they keep coming to the hospital with various conditions, bone pain, crisis, and all that.
Doctor, will my son survive?
I believe that he will survive, but with adequate medical care, he will be in and out of the hospital for time. The cast and crew have been very wonderful, very professional, and I really appreciate the technicalities involved in the and the story. Actually, storyline has been very wonderful. I anticipate that this movie will cause a dramatic change in our society in Nigeria, and we'll have less children dying from sickle cell anemia, and more people will be, the knowledge, the notion about the Ogbanje thing will be decreased, and more people will have medical attention because they have knowledge that has come through this movie. Thank you very much.